greatest need is for people living in rural areas. The provider to patient ratio is far less here than it is in an urban center like Portland or Salem or Vancouver, Washington, right? How can I do the most good with my time on this planet? It's helping the patients here.
The incredible benefit of having a rural campus, such as what we have here in Klamath Falls, is that students are able to enroll in this program and remain in the communities where they already live and work, to have the opportunity to do their schooling and then ideally stay on and serve the same community where they have been living and working is optimal. It's optimal for both the student and the community.
The program that I'm in is basically built as an online program. So all the classes that I attend with my peers in LeGrand, Klamath Falls, Ashland, and Portland, we're all on the same WebEx. We're in small groups doing teamwork together. It doesn't matter what campus we're on, we're all getting the same quality education.
The location of the OHSU rural campus is optimal. We're based on a medical campus. There's a hospital just adjacent to our rural campus building. OIT is just next door, and also get to feel that hubbub of clinical life.
There's other students who live in my area, some 2 blocks away and some a couple miles away, because we do activities together. We go, walking together, bike riding, and climbing together. But it's no different than the relationships I've built with my peers that are in Portland or in LeGrand or in Klamath.
People don't realize all that's here until you actually come and stay and live. Particularly as part of the medical community, there's just a wonderful, robust group of like-minded folks who really care about serving the community and making Klamath a healthier, better place to live.
I roll out of bed and I jog around the lake every morning. There's a ski hill right over there. There's snowshoeing. The entire bottom floor of this building is OHSU owned. And so there's simulation lab, there's computer labs. These labs are built for F&P use and for training providers. I was actually really excited to be placed here for my health assessment class so that I could have state-of-the-art gear that they have here.
They're not sacrificing anything by having their education here because they are able to still be surrounded by the clinical experiences and the complex cases that we see here in Klamath Falls.
And I just like to be here to hear their stories and help take care of them.
It's an exciting time to be among professionals that want to change healthcare, that are motivated to bring innovation into how healthcare is delivered, and it's infectious to be part of that. This is an exciting time for you to be looking inward and looking at your own resources, looking at your support systems. Reach out, don't be afraid, and take the challenge and take the next step.